I'm about to show you why the prescription water pills and low-sodium diets your doctor throws at you to treat your swollen feet are actually destroying your vascular integrity, turning your lymphatic system into stagnant concrete, and causing the exact extreme fluid retention they claim to cure, and how restoring sheer oncotic pressure and mechanical fascial pumping is the only biological way to fix it. We are dealing with a catastrophic failure of basic medical physics, and your lower extremities are bearing the agonizing weight of this ignorance. Stay with me. For the next 20 minutes, we are going to completely dismantle everything the medical establishment has told you about peripheral edema, swollen ankles, and systemic fluid retention. We are going to dive deep into the hardcore, terrifying mechanics of capillary hydrostatic pressure, the devastation of the endothelial glycocalyx, and the brutal reality of why chemically forcing your kidneys to excrete water is putting your entire cardiovascular system in a biological straitjacket. By the end of this masterclass, you will understand exactly why your feet are swelling, and you will have the aggressive biological tools to flush the fluid out for good. Comment below if your lower legs feel like agonizingly tight, overpressurized water balloons by the end of the day, making it impossible just to put on your shoes. Type oncotic if you want the exact aggressive biological protocol to fix the root cause instead of suffering through another useless prescription. Let me tell you about Margaret. Margaret was 69 years old and came to my clinic in tears, wearing oversized slippers because none of her actual shoes had fit her for over a year. She had severe pitting edema, meaning if you pressed a finger into her shin, the deep indentation stayed there for minutes. Her primary care doctor had her on the standard, highly aggressive cocktail, a massive dose of a loop diuretic called furosemide, and strict orders to eat absolutely zero salt and keep her legs elevated. Margaret was the victim of profound medical gaslighting. She was flawlessly following the doctor's orders, yet she was actively deteriorating. The diuretic was making her dangerously dizzy. She was suffering from excruciating nocturnal leg cramps. Her brain fog was so thick she couldn't balance her checkbook, and yet her ankles were still massive, swollen blocks of fluid. Her doctor's solution? He wanted to double the dose of the diuretic. When I looked at Margaret's cellular chemistry, I didn't see a woman who had too much fluid. I saw a woman who was dying of profound cellular starvation and systemic dehydration. The fluid wasn't in her bloodstream. It was trapped in the microscopic spaces between her cells, a biological wasteland called the interstitium. The drug her doctor prescribed was acting like a biological shop vac, sucking water exclusively out of her blood vessels while doing absolutely nothing to pull the toxic fluid out of her tissue. We immediately halted the dehydrating chemical assault, restored her essential electrical gradients, and rebuilt her vascular barriers. Within 3.5 weeks, Margaret was back in her normal shoes. Her cognitive clarity was razor sharp, the cramps vanished, and she had effectively flushed liters of stagnant, toxic sludge out of her body, not by attacking her kidneys, but by fixing the physics of her vascular system. To understand why Margaret was suffering and why you are desperately fighting a losing battle with your swollen feet, we have to go back to medical school physics and look at something called Starling's law of the capillaries. Your circulatory system is not a closed, waterproof pipe. Your microscopic capillaries are incredibly porous. They are designed to leak. Fluid, oxygen, and nutrients are supposed to be pushed out of the arterial side of the capillary to feed your cells. This outward push is called hydrostatic pressure. But once the cells have eaten and dumped their toxic waste back into that fluid has to be pulled back into the venous side of the capillary so it can be filtered by the liver and kidneys. What pulls it back? Oncotic pressure. This is the biological magnet of your blood, and it is almost entirely driven by a massive protein called albumin. Albumin acts like a highly charged chemical sponge inside your veins. It literally sucks the fluid out of your ankle tissue and back into the bloodstream against the force of gravity. When you get older, your stomach acid drops, your digestion weakens, and you stop breaking down dietary protein efficiently. Your liver stops manufacturing enough albumin. Your oncotic pressure collapses. Suddenly, the hydrostatic pressure is pushing fluid down into your feet, but the biological magnet is too weak to pull it back up. The fluid pools. The ankles swell. What does the standard medical establishment do? They give you a diuretic. They look at your swollen feet and assume your blood volume is too high. This is a catastrophic error. The diuretic forces your kidneys to dump the water that is currently in your bloodstream. It dramatically lowers your blood volume. But remember, the fluid in your ankles isn't in your blood, it's in the tissue. By pulling water out of your blood, the diuretic turns your blood into a highly concentrated, viscous, abrasive sludge. It's like trying to pump wet cement through microscopic glass tubes. This thick sludge violently scrapes against the inside of your blood vessels, specifically shredding the endothelial glycocalyx. We've talked about the glycocalyx before. It is the lush, microscopic, hair-like forest that coats the inside of every vein and artery. It is the ultimate cellular bouncer, preventing the vessel walls from leaking too much. When the diuretic-induced sludge clear-cuts this biological forest, your capillaries become wildly hyperpermeable. They lose their seal. They start dumping massive amounts of plasma straight into your lower legs. Your doctor's cure for your swollen feet is chemically destroying the exact barrier meant to keep the fluid inside the vessel. Simultaneously, this sludge is devastating the sodium-potassium pump. This pump is the microscopic engine inside your cells that requires an exact electrical charge to function. Your doctor told you to cut out all your salt, effectively pulling the battery acid out of the cellular engine. Without sodium and potassium to maintain the electrical gradient, your cells go into a panic state of cellular starvation. They physically cannot move the water out. The cells themselves become bloated, waterlogged prisons. And finally, we must discuss the lymphatic system. This is your body's biological sewer system, designed to carry away the large toxic proteins and dead cells that are too big to fit back into the veins. But unlike your circulatory system, which has a heart to pump the blood, the lymphatic system has zero internal pump. It is entirely dependent on the mechanical kinetic energy of your muscles squeezing against your fascial tissue. If you sit in a recliner for 10 hours a day with your legs passively elevated on a pillow, your lymphatic fluid stops moving. It literally turns into stagnant concrete. Elevation does absolutely nothing to move the heavy, toxic proteins out of the lower leg. It just lets the water passively shift, leaving the heavy, inflammatory sludge behind to rot the tissue, leading to venous stasis ulcers and excruciating pain. We are not going to manage this swelling with chemical water pills. We are going to aggressively reconstruct the barrier, restore the oncotic magnet, and shatter the stagnant concrete in your lymphatic system. Here is the exact unyielding protocol to permanently flush the fluid and rebuild your vascular integrity. Step 1 is the oncotic albumin surge. We must immediately turn the chemical magnet in your bloodstream back on. You cannot do this by eating more heavy meat that your aging digestive tract can't break down. You need free-form essential amino acids. These are pre-digested protein building blocks that bypass the stomach and immediately enter the liver to synthesize albumin. You must take a high-quality, perfectly balanced essential amino acid complex, not branched-chain amino acids, but all 8 essential aminos, every single morning on an empty stomach. This restores the chemical vacuum required to suck the fluid out of the interstitial marshland of your ankles and back into the vein. Step 2 is the endothelial sealant. We have to stop the capillaries from leaking like microscopic sieves. To patch the sheared glycocalyx and tighten the cellular junctions, you must flood your system with specific, highly concentrated bioflavonoids. You need a micronized, purified flavonoid fraction containing diosmin and hesperidin. These are aggressively potent compounds derived from the rinds of citrus fruits, but they must be in the micronized form to absorb into the bloodstream. Diosmin acts as a chemical astringent on the veins. It forcefully constricts the flabby, dilated venous walls, snapping them back into youthful tightness and slamming the door shut on hyperpermeability. Step 3 is the electrical hydration matrix. You must immediately throw away the low-sodium lye. You are going to restart your sodium-potassium pumps. Stop drinking plain, dead tap water that just dilutes your remaining electrolytes. You must remineralize. Take a heavy pinch of wet, unrefined Celtic sea salt, which contains magnesium, chloride, and over 80 trace minerals, and place it directly on your tongue before drinking a glass of water. This creates the exact osmotic pressure required to pull the toxic fluid out of the swollen cells, allowing it to be flushed out of the body naturally without forcing the kidneys into chemical exhaustion. Step 4 is the potassium-magnesium displacement. Diuretics have aggressively robbed your tissue of these two vital minerals, leaving your lower legs locked in a state of tetany and spasm. You must replace them, but the form is non-negotiable. You cannot use magnesium oxide, which is basically crushed rocks that will only give you diarrhea. You must demand magnesium glycinate or magnesium taurate. These are chelated to amino acids, allowing them to bypass the gut barrier and enter the vascular smooth muscle directly, relaxing the extreme tension in the tissue. Pair this with potassium citrate to push the sodium out of the cell and repolarize the membrane. Step 5 is the soleus lymphatic strike. You must mechanically break up the stagnant concrete in your lower legs. Passive walking is not enough. You must activate the second heart, the soleus muscle that lies deep beneath your calf. Every single hour that you are awake, you must stand up and perform 30 seconds of aggressive, explosive calf raises. You are going to violently contract that muscle, creating a massive mechanical squeezing force against the lymphatic vessels, physically crushing the fluid upwards against gravity and forcefully opening the one-way valves. You are acting as your own biological heart for the lower extremities. Your swollen feet are not a sign that you are just getting older. They are a blaring biological alarm that your vascular barriers have collapsed and your cells are drowning in their own toxic waste while starving for electrical energy. Stop accepting the gaslighting. Stop taking drugs that turn your blood into sludge. Rebuild the barrier, restore the magnet, pump the concrete. I'm Dr. Amelia Carter. I'll see you in the next video.